Okay, hello everyone. Welcome. Thank you so much for coming today. I'm looking forward to our conversation. Good morning. I'm proud to welcome everyone to today's second session called Thriving versus Surviving: Life After Being Diagnosed with CKD and Living Your Best Life. My name is Nadia Kayati, and I will be your moderator for about the next 60 minutes through the session. And I'll just take this opportunity to tell you a little bit about my journey with kidney disease. Well, I was diagnosed with type 1 diabetes at about the age of 9, so I've lived with the condition for over 20 years now. I was first diagnosed with kidney disease in late 2019, and from first hearing the words reduced kidney function to having kidney failure and opting to go on dialysis was just under 3 months, so it all happened very quick for me. I went on dialysis the week that coincided with the beginning of the pandemic and sort of the lockdowns across Ontario, where I am. So the experience has been made even more interesting by that added layer. Currently, I have finished my screening for joining the transplant list, and I'm very much looking forward to all that may bring into my life. At this point, I just wanted to give you the friendly reminder that if you would like to submit any questions at any point in time throughout our conversation, please do so in the Q&A box. Depending on what kind of application you're using and device, it's either going to be located at the top or the bottom of your screen. And then we'll answer all the questions during the end portion of the session, and we will talk amongst all of our speakers. So at this point in time, it's my pleasure today to introduce everyone to our first speaker, and that's Ian Holzer. Ian is the director at Dialysis Management Clinics, where he helps to lead an organization that supports about 170 patients across 3 locations in the GTA. And in addition, Ethan serves as a director at large on the Kidney Foundation Ontario branch board. So good morning, Ethan. I'll turn it over to you.
Thanks so much, Nadia. I'm going to see if I can share my screen here. Can you see my presentation?
Yes.
Yes, yeah, okay, great. Wonderful. Thank you for whoever responded. All right, so I'm going to try and do my best to give a provider perspective on this really important topic, thriving versus surviving. Of course, I think later in this session, you're going to have 2 really exceptional patients talk about this, and their experience, I think, provides really good insights. But my role here is to try and give you a little bit of a context of how, as a provider, we can play a role in helping you thrive. So there's a couple of or 3 guiding questions I thought we should talk about from my perspective, and that's whether or not our healthcare system right now is surviving or thriving, and what those contrasts look like. How our healthcare system really can impact those seeking to thrive in their care, and what strategy is most commonly observed in those thriving with kidney disease. So is our healthcare system thriving or surviving? I'm sure most of you know the answer to that question, and I would actually argue that pre-pandemic we were in survival mode as a healthcare system, and the article here really illustrates that. So in 2018, there was an article published by Joshua Tepper, who at the time was the CEO of North York General, but he previously was the CEO of Health Quality Ontario. In the article, he pulled out some research that showed that 1/3 of nurses in Ontario have PTSD, and 1/3 of doctors are burnt out. So to give you a sense of where our healthcare system was going into the pandemic, we were surviving. And you can just imagine where we're at now, 2 years in. So to give you a bit of a sense of what a surviving unit can look like and what a thriving unit can look like, I tried to put a little bit of a chart here together. So the first thing I think would be observed in a surviving unit is that typically no one takes a day off. So it's the same people working And eventually those same people become people you don't know, because there's only a certain amount of effort and time and resources that people can put in until they are burnt out and unable to work. So you start with a unit that you see the same people working all the time to potentially a unit that you don't even know who is working there anymore. In a thriving unit, on the other hand, I would say you would see joy in work, or what some people call the dream team. So joy in work can mean many things, but oftentimes it's laughter, it's friendly discussion, it's patients knowing each other, it's patients knowing who their caregivers are. In our units, one way that we try and enable joy in work is that we introduce music. Music is therapy for many people, so we don't have music on throughout the day, but certainly during times where it's busier, patients are not necessarily on treatment, there is music on, and our staff and patients really appreciate it. Certainly in a surviving unit, it's unclear who leadership is, or there might not be presence, whereas in a thriving unit, the ownership of care is quite clear and decision makers are typically known. In a surviving unit, you can see delayed and deficient care, which we're seeing across our healthcare system, and certainly a lack of empathy and time from caregivers. Whereas in a thriving unit, things will be efficient, consistent, and the approach to care would be patient and typically compassionate. So on the idea of, does our healthcare system impact your ability to thrive? So there's a quote that's often referenced in healthcare improvements, and specifically from the Institute of Healthcare Improvement down in the States, where it says each system is perfectly designed to give you exactly what you are getting today. So what that means is you could be a patient that has every intent to thrive in your care, but if you walk into a unit that is chaotic, that is in survival mode, it's going to be very challenging. Let's say you're dialyzing or sitting next to a patient that is doing really unwell and is requiring a lot of support. It would be very difficult to thrive in that sort of environment. And given that the majority of our healthcare system is in a bit of a survival mode, I can understand and empathize why a lot of patients are struggling with the ability to thrive. However, there are exceptions to this rule or this sort of saying, and that is when a system is designed on the feedback of patients, typically patients are better able to thrive. So there's a few examples of this, one of them being home care. So historically, our healthcare system was very much provider centric. So we built large institutions, large hospitals, and we sort of said, if you're unwell, you come to us. Eventually, we sort of realized that, patients actually do better if they're in the comfort of their own space. So why don't we come to them? So it was a bit of a reverse design that was really pushed by patients and forward thinkers. But those that have the resources and that are able to receive their care at home typically are doing quite well. Another good example of this is virtual care. So pre-pandemic, virtual care was pretty absent in our system. We had a really challenging and clunky technology that we were asked to use. And as a result, we weren't able, or many providers weren't using it. The moment the pandemic started, we needed to use virtual care. So what did we do? We contacted our patients and said, how can we provide you with care? And they said, can you FaceTime me? Can you Zoom me? Can you phone me? So it was patient driven, and all of a sudden you saw how technology could really enable patients easy access to virtual care without bringing the added risk of coming into a setting and exposing them with a potential risky virus. So the other exception I think that I like to talk to our staff about is there's some easy ways in our dialysis units that we can make care a little bit easier for our patients. And really all of this is through feedback from our patients. So I'd say it's four general things: lights, noise, chair, and temperature. And you can see in the bottom there, I did not include a picture of a dialysis unit. I included a picture of a airplane. And I do that because when I have conversations with our staff, I stress to them that you're never going to understand what it's like to be a dialysis patient. You're not going to understand what it's like to be in that chair But there is the closest way that you could potentially empathize or understand that experience is to think back on what it's like to fly in an airplane, because I don't know anybody that enjoys flying. And there's a reason, because you are stuck in one chair, you have nowhere to go, you are sort of forced into this. And typically it's noisy, the lights are on, and it's uncomfortable. But I stress to them, there are times during a flight that things are a little bit more comfortable. And typically it's when you are in flight. When you're in flight, the flight attendants or whoever controls things turns off the lights and the noise goes down. And typically the temperature is better. So that's the most comfortable time during the flight, and it lowers people's stress. So why can't we apply that same principle in dialysis? So typically in our units, we turn off the lights during dialysis. We lower the alarm levels on our machines so it's not as loud and not as noisy. We ensure that our patients have a consistent chair that they're going to. It's kind of maybe what you'd expect first class if you're flying, but the same chair, and it's more comfortable. We're transitioning to chairs that have heat, and that we're also based on patient feedback. So we brought chairs into the unit and got our patients to try them, and they selected it. And then temperature is a little bit more challenging, but certainly moving people around the unit to find an area that's more comfortable for them temperature-wise. And some of our stations do also have ceiling heaters as well, which helps. So from a patient perspective, I would say the one thing that we see that's most consistent around patients that are thriving in their kidney care is patients that are participating in their care. And this is not just from our personal experience, but it's also backed up by evidence. So in the United Kingdom, they've actually transitioned to a sharing hemodialysis care model for the entire United Kingdom. And this is for all dialysis patients, because what they saw is the more patients participated in their care, the less visits they had to their GP, the less likely they were admitted to hospital, and the better mental and physical health they were in. And the simple reason is because people who understand their condition are better able to monitor their diet, fluid, and medication, and they also know how to reduce the risk of complications and generally know when to seek help. So what does participation look like? It was actually kind of challenging to find a picture of a patient on dialysis that I felt looked like they were participating in their care. This was the only picture I could find. And the reason I feel like there's participation is because, one, the patient looks generally comfortable. They're sleeping, and they've brought in their own stuff from home, likely. So looks like they have their own blanket, their own pillows, they have their iPhone hooked up to their ears, they have their arm in the position that they're comfortable with, the lights are off, and most importantly in this picture, the dialysis machine is facing the patient. So how can you participate in your care if you can't even observe what's happening during your treatment? So one thing you'll see in all of our units is it's pretty clear that all of our patients are able to view their treatment. Whether they want to participate or not, we turn the screen to them so they can see what's happening, because who's gonna know when you're starting to feel unwell first? It's you. It's not necessarily us. So although this patient is sleeping and comfortable, they have their blood pressure cuff on. If something goes off, they can look up and see what's happening during their treatment. So participation is not an end game where you have to do everything in order to be well. It could be as simple as, I'm going to take part in hand hygiene, or I'm going to do my weight, or I'm going to take my temperature today, or I'm going to understand what my blood pressure is and help to monitor it. Or maybe I'm going to do a better job of understanding diet management and understanding my lab results. It can go all the way to cannulating yourself, to even doing your own treatment. So any participation really makes a difference, and you don't feel like you have to go all the way to one end. But typically at our sites, all of our patients do hand hygiene. They are able to take their weight. Many of them set up their chairs, so not the dialysis machine, but they put their linens out, they put their pillows out the way that they feel comfortable, and they're all able to look at their treatment throughout care. So I talked a little bit about how in the UK they saw a big difference when they increased patient participation in care. We only recently started looking at some of this data on our end. We've been doing it since 2017, and it's been pretty consistent in what we've seen. And so it's not just patient participation, it's also patient design. So, you know, the airplane sort of model, what I was talking about there, that's patient design. I would say one of the big markers that we see is in suboptimal dialysis. So that little chart you see on the side here. So suboptimal dialysis is ideally something that we don't want to see, but it's impossible to be at zero because ultimately the biggest marker of suboptimal dialysis, which is not good dialysis, is whether or not you're able to get through dialysis treatment. So if you're constantly skipping treatment or cutting your treatment time, you're likely not getting good dialysis, which means you'll be in this category of receiving suboptimal dialysis. So we average around 8% at our clinics. In Ontario, it's roughly 20%. And I would say the biggest difference is we make what is a pretty difficult treatment less difficult. So if you're able to stay for your full time because you know which treatment chair you're going to be in, the lights are going to be off, it's going to be quieter, you generally know who's going to be looking after you, it makes it easier to get through treatment, and typically you'll do better. Certainly we look at as well, you know, patient experience, and we do quite well with that. Hospitalizations is another one we look at, and this data is from 2020, and we saw a big decrease, but we've seen it every year. And then certainly from a COVID-19 perspective, you know, I think it's important for patients to understand why certain decisions are made and try and involve them in those decisions so they understand the risk level. So we were pretty transparent with our patients around the risk level of COVID at the onset, why we felt like it was necessary to take some additional precautions, why vaccination was so important, and the results were there. We haven't seen any transmission within our clinics. We've obviously seen cases, but have not seen transmission because our patients are really good at wearing their masks and understanding what they need to do. And vaccination is really high. We have the highest vaccination rate in the province at 97% of patients vaccinated. So I would say in conclusion, and I didn't get to chat about all my thoughts on this, but I would say our healthcare system is in survival mode. Maybe there's a different way to describe it because we were in survival mode pre-pandemic, but we are certainly surviving, but that does not mean you cannot still thrive. And the way that you can thrive is to participate in your care to any extent possible. And remember that you have agency to influence change in the design of your facilities. So your experience and your voice matters. So getting involved in your units, letting them know what matters to you really does make a difference. And most importantly, don't forget, when you thrive, you help us as providers thrive too. So part of this journey of getting out of survival mode as a healthcare system doesn't have to start with us as providers. And in many ways, it can be driven by patients. If you are thriving, it helps us as providers thrive too. Thank you so much.
Thanks very much, Ethan. Those are some great points. You talk about comparing a heated chair to a first-class flight, and I couldn't agree more. When I was first diagnosed, I was on hemodialysis, and it was, you know, what can seem like to some as a smaller sort of components of your treatment, like those environmental factors really do make a big difference to your overall experience and how you feel about participating in your own care. So thanks again, Ethan. I would now like to introduce everyone to our second speaker, and that is Lynn. Lynn is a home hemo patient, and she works in the community and social services sector. So thank you so much for being here, Lynn. I'm going to turn it over to you so that you can share a little bit more about your journey.
Thank you. Thank you, Nadia. I also would like to thank the staff at the Kidney Foundation for the support you've provided so far in my kidney journey. From the first day I called seeking information about joining the support group, I felt the warmth and support from the staff. I thank you as well for providing the opportunity to share my story today and hope that it will provide inspiration for those who are in need. So my kidney story begins. I was diagnosed with chronic kidney disease 8 years ago at the age of 53. At that time, I was not experiencing symptoms, My doctor noticed some of the abnormalities in my blood work and sent me for further testing. I've been hypertensive for about 20 years, and although well managed, my kidneys were damaged as a result. For the first 5 years, the disease progressed slowly, but beginning about 3 years ago, it started to advance more quickly. I began the training for home hemodialysis a year and 7 months ago. I trained for 4 months, at times thinking that there was no way that I could do this. I tell myself that I didn't have nursing skills and there was so much that I didn't know. My sister, who's also a nurse, had to talk me off the ledge a few times. With the patience of my home hemodialysis nurse, I was finally at the level where I could do my treatment safely at home. So I can relate to what was just said by the previous speaker in terms of the comfort of having your own doing it in your own home. It's currently going well. My dialysis journey has been life-changing, as it has been for many of you here today. It took me a while to gain new vision for my life where I could go from scared to surviving and then to thriving. I was scared because I would look up to see what Dr. Google had to say about kidney disease. I read that life expectancy for people on dialysis was 5 to 10 years and high risk of an unexpected death. All I could think about is that I was only 59, just got married a year previously, and I wanted to live I wanted more time to live life and create memories with my husband. It made me anxious whenever I set up my machine at home, so I was extra cautious not to make mistakes. I got through that period with strong support of my husband, which I often said is a gift from God. We got married August 3rd, 2019, and I began dialysis August 5th, 2020. He came into my life at just the right time, and he embraced the role of care support and which helped to ease some of my anxiety. I am the primary caregiver for my 94-year-old father who has dementia, and Shawayne, who also assisted me in providing care for him. I also received a great deal of support from the home hemodialysis team at the UHN, my siblings, friends, and in particular 2 friends who had been through dialysis and later received transplant. My Christian faith also helped me through this period. As my confidence in managing home hemodialysis grew, as my husband and I established new routines at home, and we learned to cope with my new situation. So by now I had moved out of scared into survival mode. At this point, I made plans to go back to work. I returned to work for 3 months, but due to the demands of the job, I felt the need to take more time off. This was not necessarily because of dialysis. My treatment was going well. Except for minor issues, everything was good. Work was stressful, and even though I was working remotely, I was working long hours in a new position. My father's dementia was advancing, so it was stressful for me at that time. I was not happy with the quality of my life that I was living. I used to say that I turn off my laptop and turn on my machine. I became even more anxious when there was talk of returning to the office, as I anticipated how taxing it would be to balance work, caregiving, and dialysis. My husband and I decided it was best to take more time off. It was at this time that I reached out to the Kidney Foundation to join one of the peer support groups. I needed to hear from others who were living with kidney disease to learn how they manage their lives. I met others who were living their lives for years with kidney disease, contrary to what I believed. This provided me with hope. I attended many of the online events organized by the foundation, which increased my knowledge of kidney disease and transplant. The knowledge and support from the foundation put me in a better frame of mind to envision more for my life than having kidney disease. I have continued to do employment coaching for now on a volunteer basis. I am re-engaging in church activities and reassuming a few responsibilities that I had held. My husband and I are hosts for international students. As restrictions lifted and with precautions, we're looking to begin hosting students again. Now, if that is not enough, I've registered to take a university course in the spring. I'm still experiencing fatigue, and I've been learning to listen to my body. If I can't accomplish the long list I have planned for the day, then I aim for the short list. Dare I say that the quality of my life has been better since being on dialysis? Yes, physically, I don't always feel 100%, but the key for me is realizing that I choose to engage in the activities at a pace that is best for me. I choose to take care of my physical by carefully following the dialysis prescription, exercising, and eating well. I care for my mental health by listening to my body and seeking help when I need it, and I also focus on my spiritual health. So that has been, with my spiritual, it just helps me to stay faithful, optimistic about my future possibilities. So I just want to thank you for listening to my story today.
Thank you so much for sharing, Lynn. I really appreciate that. I too was drawn to contacting the Kidney Foundation when I was experiencing moments of isolation, and I can tell you and all the participants here that I've just felt a different way since participating in the peer support groups, that the disease doesn't necessarily define your life. And it's been really great to build that sense of community. It helps you to have something to look forward to and a place to share common experiences. So thank you very much, Lynn. Some great points there. So now I'd like to take the opportunity to introduce you to the last speaker of this session, who is Alex Moore. Alex has experience with PD dialysis, has received a kidney transplant, and is now on nocturnal dialysis. And Alex is an entrepreneur, an avid cyclist, a barista, a chef, just to name a couple of the things that Alex does. And so now, Alex, over to you to tell us a little bit more about your story.
Yeah, hi. Thank you so much. I hope I hope I'm clear enough right now. Yeah, so I guess my kidney journey started a long time ago when I was 11. Literally on my 11th birthday, I got chicken pox, which inflamed my kidneys and set off my autoimmune disease, and within 3 months I lost my kidneys to full renal failure, and from there I was put on PD, and that's kind of what started everything rolling for me. So I've been doing this for 19 years now, and it's really funny what Ethan was talking about earlier about patient participation. It kind of like made me harken back to like all those days like on PD when I was 11. And I think what really started my journey towards thriving was definitely participating in my own care at a really early age. So McMaster and Sick Kids were really good always about kind of communicating what I needed to do as a patient and what I needed to do for myself as a patient to like get myself a level of care. I did my own PD treatments. I made all my own decisions from like the age of 11 onwards. And from then forward, when I had a transplant, it was entirely my decision as to how my care went. And I was only 14. When I got out of the transplant, I was encouraged to get a job in hospitality by my parents. So that kind of started the coinciding of like me working while simultaneously being on dialysis and doing a heck of a lot of other stuff with school and stuff all together. So my entire journey kind of also is about me overworking a little bit in order to kind of create a life for myself. I think one of the big things for me is that I have always kind of pushed myself to do a lot in life and create a lot of opportunities for myself. So going forward from the transplant, I worked a lot, I made a lot of friends, I did a lot of community work in my school during the 1 year that I had a transplant. My disease had already come back into the kidney within like a week of me getting a transplant, and they weren't able to save it. So in May of 2008, after getting a transplant in January of 2007, that's when I lost it. But in that 1.5 year period of time, I was part of like community outreach groups in my school. I was doing work with the Kidney Foundation already, doing organizing tag days so that we can like raise money for the Kidney Foundation. I was part of the God Squad in my Catholic school, so we were setting up for masses, constantly doing community outreach, things like that. And that all started and I was also running a couple different clubs. So I was running the anime club at my school, and I was also helping run the chess club and also helping with a magazine in the school. So doing all of that while just getting a transplant. Then when I transitioned from having a transplant to dialysis again, I started on hemodialysis. And I was on hemo, but I was living in the country. So they told me that I should probably go on home hemo. So through Sick Kids, I learned how to do my own hemodialysis at home. And so I was on home hemo for about 2 years until I decided to move out of my parents' house at the age of 18. From there, that was probably my lowest point, moving out of my parents' house, because my mom has been an incredible support for basically my whole life. Even now, with me being an entrepreneur, she is my accountant. Currently, so at that point in time, I was basically bouncing around a bunch of different places, didn't really have a job, didn't really have many prospects in life. And finally, my mom encouraged me to move back in with her. She then also encouraged me to go to culinary school. And again, her being the supporting powerhouse that she is, helped me get a job, helped me get my life back on track again. So I went to culinary school, and through the culinary school, I started 15-hour days at the school, both being the TA at the school, helping run events there, and going to school itself while being on short daily dialysis. And I would sleep through a lot of my classes because I was so tired doing all that stuff. But I managed to make it through culinary school with flying colors, which was great. I still have a close personal connection with my teacher, the chef at the school. And from there, I moved to Toronto because I'd always wanted to move to Toronto. Coinciding with all of that, I was also going back to the Anime North roots. I was so the Anime Club roots, I was actually helping run Anime North as part of the panels department. So Anime North is a big community-run anime club, essentially, that meets every year. But we're actually also a non-for-profit that helps support Sick Kids. So it was kind of coincided with my interests, and I feel everything that I tried to do in my life, it seems to always have these connections where I want things to have a charity or a sort of community-oriented background while simultaneously coinciding with my hobbies or interests. So, most of the jobs that I've taken, I've tried to take things in hospitality that I believed in or would garner me extra skills, but my favorite jobs have always been places that were community-oriented. So either way, I moved to Toronto. Within a year, I got a job at this tea house. Weird place. Take off your shoes when you walk in. You lounge around in these booths and everything, drinking pots of tea. Real den of hippies. But I loved it. And the place was always filled with art. It was filled with music. I worked 80-hour weeks trying to make this place run. And I worked myself to the point of exhaustion entirely too many times. I skipped so much dialysis during that year that I worked there. And at the end of the year and a half of working there, the owner told me that I wasn't worth the money that he was paying me. So I had to leave. And that kind of broke me because I'd invested so much time and effort into this place while simultaneously being on dialysis, while simultaneously doing all these community efforts. And so I went and worked on myself. I did yoga teacher training while also working and doing dialysis. At that point, I started doing nocturnal. And that's the point where I'd actually met Sadia through nocturnal dialysis. So she kind of knew me just shortly after like I had like lost the tea house and everything as like a prospect in my life, and so she's kind of like seen me go through this like journey of like struggle where I lost this, and then I like kind of started working my way up through the industry. So I started like working as a server. Then I started working as a barista. I worked as like I worked with national champions. I like grew my skills. I then also started actually running the panels department at Anime North. I started doing peer support with Sadia, where we would go into sick kids and talk to patients, and you know, that was really fulfilling. Started doing a lot of just a lot more like work on